So I'm joined now by some of our speakers, Winfried, Suzanne, Hannah, and also Jess, who's our new Director of Services. We've had some great questions coming in. I know some have been answered directly in the chat, but we've got lots more, and keep posting them. So I'm going to start, Winfried, with you. We've had some questions around diagnosis and treatment. So my first one is, somebody has asked, how early can inherited genes for macular disease be detected?
Thank you. That depends on the particular type of inheritance. So generally we say the earlier is, we see the patient and make the diagnosis, the better, because then we catch them at the early phase of the disease when treatments become available. At the moment, it's probably not as important, but yes, when you notice the child has a problem with the eyes, then you, of course, the medical retina specialist will see them and make a proper diagnosis. Once that diagnosis is made, then we start looking for potential genes that are responsible in preparation for future treatment. Does that make sense? So
Yes.
at the moment, we can't treat them, but we believe that the earlier the diagnosis is made, the better the chance of saving the residual vision when treatment become available.
Yeah, and if anyone's particularly interested in Herited, our webinar last month was all about genetic counselling. So have a look on our website. There's a webinar that's purely about genetic counselling. So we've got a lot of people who are listening in, watching, who clearly have macular disease and are worried about further deterioration, particularly when there's no treatment available. And we know that there's a lot of evidence, isn't there, around supplements. So what can people do to prevent further deterioration, and how beneficial are supplements in that?
Talking about macular disease generally or inherited diseases?
Macular disease generally.
So, yes, the evidence for nutritional supplements is mainly to do with progression of dry age-related macular degeneration to the later stages. So the evidence shows that if you have intermediate AMD or late AMD in one eye, you can stop the progression or reduce, not stop, you can reduce the progression to the later stages by about 25 to 30%. Now, unfortunately, it does mean you will have some progression. It's just the rate at which that progression occurs is reduced, and the extent of that progression is also reduced. However, there will still be some progression. But we believe that the earlier you start the supplements, the better. Now, we've extended that to say that if you have early dry AMD, yes, you lose nothing by taking those supplements, because again,
we're talking about AREDS 2, aren't we? It's very specific, isn't
yes.
it?
We're talking about the AREDS 2 preparation, and the closest. Well, so there are different preparations on the market.
Yeah.
Okay, there are different preparations, some of which have been copied or based on the AREDS, but don't necessarily represent the AREDS preparation, because everybody wants to produce their own. So if it's the proper AREDS preparation, AREDS 2 preparation, which contains vitamin A, C, and E in particular concentrations, as well as lutein and zeaxanthin, then yes, that reduces the progression by 25 to 30%. But you've got to make sure that you're not just taking any preservative because somebody has come up with their own concoction.
Yeah. And Jess, I know you've been reviewing, haven't you, our material on what we say about AREDS 2. Is there anything you want to share with our audience, particularly around, what we're saying now as an organisation around AREDS 2?
Yeah, thank you. I mean, it's really exciting, the opportunity to be able to change the course of the progression of this condition by something as seemingly straightforward as a nutritional supplement. So yes, at the moment we are reviewing our information on the website about these supplements, and we've got a great new page coming soon, which is going to really clearly set out what exactly the AREDS 2 preparation is, where you can get it, and what types of AMD are most likely to see a benefit. So I'd really encourage you to check that out when we get it. And if anyone's got any questions about whether these supplements are right for them, you can always call the helpline, and we'd be very, very happy to support with that.
Brilliant, brilliant. Suzanne, it's always really powerful hearing the stories from people that we support with counselling, and somebody's asked, they're saying they find it really difficult to talk to their family about their sight loss. Do you have any tips for them on how they could navigate those conversations?
I think it is really hard for lots of people, sort of deciding how much to share and what to share, what not to share, etc. If that person was able to come through to the counselling service at the Macular Society, I think we could help them with that. Quite often, clients that we speak to will use the conversations that they're having in the counselling sessions as a way of starting a conversation with somebody at home. So, for example, to go back and say, in my session today, we were talking about how I find it really hard to just share how I feel generally, and perhaps sort of continuing from there. And I think for people to remember that it doesn't have to be one huge conversation. It's just kind of making a start somewhere. And even if that's, deciding that once a week when you sit down and you have a cup of tea together or whatever it might be, to just gently start sort of dipping your toes in, not everything all at once.
Yeah. And remind people, how do they access support from the counselling team?
So they can access the service online. We've got an online referral form, which is really easy to complete. Or they can call the helpline 0300 30 30 111. Once they've made that referral, they'll generally receive a call just to check their availability, check that we're the right service for them, and they will be offered a telephone assessment within 10 days. So it's all pretty quick.
Fantastic. So yeah, 0300. Oh blimey! Now see, I've forgotten the number now. So 30 30 111. 0300 30 30 111. Oh yeah. Hannah, somebody's asked, do I need to buy low vision aids or equipment from specialist organisations or suppliers, which presumably makes it quite expensive?
It does. So the short answer is definitely no. I think there is definitely a time and a place for these specialist suppliers, particularly for people that may be a lot further along with their sight loss and have particularly low vision. Sometimes that's where specialist equipment can be really handy. But honestly, there are so many amazing, cheap and high street alternatives out there. And I think it's really important for people to have a good understanding of their vision loss and the types of tasks that they think these low vision aids would be suitable for. And we always say it's great wherever possible to try before you buy. It's always wonderful when you hear about all these recommendations, but just because it works for one person doesn't necessarily mean that it will be the right option for you. So particularly in the session that we just played, those tips from Ed, Caroline and Pat, those were all fantastic because those are really great starting places for some people to kind of dip their toe in the water with some of those cheaper low-tech options for low vision aids. So you don't have to go fancy straight away.
Yeah, and remind people how they might access the support from your service if they're listening now and they're like, well, I need some extra help. What do I do? How do they contact your team, Hannah?
So the easiest way is still to go through the helpline, and they can either pop you straight through to our lovely team. So it's usually either myself or the lovely Natalie that was on the end of that video that will be fielding your call. So for any new referrals, we go through, it's called an assessment, but that sounds very formal. It's not. We just have a really lovely conversation to kind of understand what people's needs are, what the best form of support is, whether that is us talking through some lighting and low vision aid options, or whether we then offer some one-to-one support around eccentric viewing training as well.
Cool. And just in case anybody's trying to call today, the service is open Monday to Friday, 9 till 5. You can either call that 0300 30 30 111, or you can email help@macularsociety.org. So yes, apologies if you're like, oh, well, I'm going to get off this and I'm going to ring immediately. You will just get the answer phone message today, I'm afraid. Winfried, I've got a complicated question that I'm going to ask here. So somebody has asked, what causes submacular hemorrhage and are there any treatments?
Right. Okay. Well, submacular hemorrhage essentially means you bled into the retina, and below, underneath it, and usually that's in the center of the macula, the fovea. It can be due to several things, or several potential things. Wet macular degeneration is the classic cause. Then you have something called retinal macroaneurysms. Okay, and sometimes you can have trauma. Those are the common causes. There are smaller or less common causes. So generally the blood will clear if there's no further bleeding. However, if it's not clearing, the only option left to you is to go in surgically to remove it, to take it off. We don't often do it because most of the time we believe it will clear on its own. However, if it's not clearing, then you refer to a vitreoretinal surgeon who will go in and take the blood out. But you need to treat the underlying cause itself. So if it's wet macular degeneration, yes, you need to continue to treat that. If it's a macroaneurysm, you need to treat that, and you treat that either with injections plus or minus laser photocoagulation, depending on where the particular macroaneurysm is. So yes, the treatment varies depending on the extent of the bleeding and the exact underlying cause.
Brilliant, thank you.
Can I just add to something Suzanne said earlier?
Please do. Always feel free to chip in as well.
Yeah. So I think the counseling, what the patient says to their relatives, I think is important. But the patient himself or herself needs to understand what the condition is to be able to have that conversation with the relatives. So it's always good to bring a relative with you, somebody you can trust, or friend with you to the consultation. If you don't think you understand all that is being said, or you will recollect it, because then once you understand what's happening, you'll be able to sell it. I call it sell it to the family or close relations much easier than if you didn't have the full picture yourself or full understanding as to what's happening.
Yeah. Well, also, it's very complicated, isn't it? You know, there will be quite a lot of people for whom this is the first time they've ever heard the term macula, never mind anything else. So, yeah, if you do have somebody that can go with you, do take them, and also know that we are here. So if there's anything you need, we can help, we can support. We've got lots of information. We have amazing people who answer our helpline, Hannah's team. So I think don't feel that you're alone. We can help. To that point, Suzanne, are there any proactive ways that people can manage those negative feelings around sight loss? You know, we know, don't we, when you survey people, the sense that people are most fearful of losing is their sight. So are there practical things that people can do to help some of that negative thought around losing their sight?
I think the main thing is to try. It's very difficult because it depends at which stage. Like if we're talking about the stage of diagnosis where people often feel completely overwhelmed and it's very difficult to absorb what they're being told at that stage, it's really hard. Further down the line, I think when a little bit of time has passed, I think the main thing is to try as hard as you can to focus on the vision that you do have, and being able to use that vision that you do have as effectively as you can like with these skills for seeing team and some of the tips they were describing, I think also it's really important to try and live your life, important for all of us, but in the here and now, because quite often what happens is, and this is perfectly natural and normal, often people will get so anxious that they start to live their life as if their sight has already deteriorated. So their world becomes smaller and smaller, when actually it's really important to remind yourself, okay, what is the situation now? What are the good things in my life? You know, to sort of open it up so that you're not only focusing on lack of vision, focus on the things that you can do, or if you're very mobile or you've got lots of friends, and just try and keep coming back to the here and now rather than what will happen in 5 years, what will happen in 10 years. It's sort of training your mind, a lot of this, in a way of managing that anxiety.
Yeah, brilliant. Thanks, Suzanne. I'm going to ask this question to both Winfried and Hannah. So somebody's asked a question specifically about the alternative to injections with iodine, which, Winfried, would be great for you to answer. But Hannah, we do offer support for people with injections. It's very shocking, isn't it, often when people are told you need an injection, and we all presume an injection, it's in your arm, and it's not for macular disease, it's in your eye. So Hannah, what support can we give people in terms of coming to terms with that? And then Winfried, I'll come to you to ask, you know, we know a lot of people are struggling with iodine. What are the alternatives? So Hannah, you first, please.
I'm glad you're not coming to me for the medical side. I was absolutely going to hand that one off. In terms of more of the emotional support around it, we have an amazing team of volunteers that are called our injection buddies, who can offer a really lovely kind of support call, particularly if you are new to having injections. We understand that it can be a really frightening experience, exactly as you said, Emma. When we first think of injections, we typically think of something going into your arm, not your eye. So for a lot of people, they want to be able to manage some of their expectations going into that. So talking to someone else who is currently having or has recently had injections can be really helpful. And they're obviously not there to provide any medical advice or to persuade someone whether or not they should go ahead with the treatment. But for some people, it can just be really helpful to hear from someone who has experienced that and allay some of those fears. And some of our befrienders also are still regularly having injections. So sometimes we'll make befriending matches based on treatments that people are receiving, because I think that peer support within our amazing macular community is so important and can be really helpful. So again, both of those services can be accessed through our helpline. And yeah, I would definitely recommend getting in touch if you do have fear around first step treatments.
Brilliant. And Winfried, is there an alternative to iodine?
Well, yes.
Good.
I will. There is an alternative, but I will explain the rationale for using the iodine to start with. So, as we know, we have bugs on all parts of the body surface, including the eyelashes and on the surface of the eye. And it's important that we use these antiseptics in order to get rid of those bugs, because we don't want those bugs to get into the eye. Because once they get into the eye, you have an infection, which, if you think of the general body, is equivalent to septicemia. The eye dies if we don't treat it properly. So we want to stop the bugs getting in to start with. So the best way of getting rid of those bugs on the surface of the eye within the lashes is to clean the eyelashes and the conjunctiva, the surface of the eye, with iodine, because it works very fast and kills anything in its way. Unfortunately, some people are sensitive. I wouldn't say allergic. Iodine allergy is very rare. But some people are sensitive. The surface of the eye is sensitive, especially if you use it a few times. Then the surface becomes slightly raw. And especially if you rub it after the injection, then the eye becomes painful and gritty. So two ways you can you can prevent that or reduce that. After the injector has cleaned the surface with the iodine, it's good to wash it off with saline. and that reduces the chance of that discomfort subsequently. But if it's a true allergy or it's very severe, then the alternative is to use chlorhexidine. Chlorhexidine, again, comes, is what we used to use for surgical, for cleaning the surface of the skin and so on before surgery, before iodine became widely available. But you got to make sure you use the chlorhexidine that is good for the surface of the eye, because what's good for the skin has slightly detrimental effects on the surface of the eye. So it has to be a special chlorhexidine preparation.
Brilliant.
So yes, there is an alternative, which is chlorhexidine. If it's but if you don't have that, you want to just wash the surface of the eye with saline after the iodine has done its job, and then you give the patient eye drops, lubricating eye drops after the injection to take home. It's also important that you tell the patients not to rub the eye, because the local anesthetic lasts for about 30 minutes to an hour after you've done the injection. And if you rub the eye whilst it's frozen, unfortunately, it becomes excruciatingly painful after the local anesthetic has worn off.
Don't rub your eye. We are rapidly running out of time, I'm afraid. Jess, I'm going to come to you with the last kind of viewpoint. So you've joined us in April. What's the one thing you hope anybody diagnosed with macular disease gets told knows?
I really think the most important thing when you're first diagnosed is the information and support to empower you to understand what the condition is, what the various different options are for managing it, what is likely to happen down the line, and how you can live, to Suzanne's point earlier on, in the here and now in the best way possible. Because we know that macular disease is really difficult to live with, and especially as sight loss progresses, it has a huge impact. We know that, and I think having the right information and support at the right time at the point of diagnosis will give you the tools and skills you need to empower yourself. Yes, on the emotional side, because there are a whole lot of feelings associated with a new diagnosis of a condition and with changes in vision. On the practical side, because there are things that you can do to make life easier, going about your day-to-day life and achieving the things that you want to achieve in life, so that you can still maintain that quality of life that you hope for. On peer support, connecting with other people who are feeling similarly to what you are and who are going through a similar thing, that can be incredibly valuable. And I think at first diagnosis, that's really important. You've got to understand what it is. The information, the advice and support is really, really important. As your journey with macular disease continues, as you start to experience more changes in your vision, it's, I think, even more important then to kind of keep coming back. We can provide services throughout your whole journey with macular disease, both at diagnosis and throughout the rest of your life, to really just help you get the most out of life and keep the things that are really important to you. So that would be my number one thing I would love for everyone diagnosed with macular disease, to be given the right information, to know about the Macular Society and the services that we offer, and that way we can be there, we can support. And too many people come to us when they're already feeling really low and really anxious about what's happened because of a lack of that support initially. So yeah, that's what I would like people to.
Brilliant. Thank you all so much for your time today. It's been, I hope for everybody who's joined us, you've found it really helpful and really useful. All of these are recorded, so if you've missed anything, you can listen again later. And we are here. That free phone number again, 0300 30 30 111.